Good morning, students. Myself, Dr. G.R. Patel, Professor of Surgery. Today, we are going to talk about various newspaper articles which are published, say in Times of India on various dates they are published. So, we want to keep a record of these publishing medical articles. And so, this is a slides that I have prepared. I hope you will like it. World No Tobacco Day. In India, every year, 6 lakh people die due to tobacco consumption. In India, every year, 55,000 children get addicted to tobacco. Today in India, 240 million people are addicted to tobacco. About one third of total addicted people of the world belong to developing countries. Daily, 11,000 people die in the world due to tobacco. In India, 50% of all cases of cancer are due to tobacco. Disease caused by tobacco. There is a very long list of the diseases caused by tobacco. Cancer, heart attack, asthma, emphysema, emphysema, trismus, inability to open the mouth. Inability to open the mouth, cough, lung infection, high susceptibility to tuberculosis, mouth ulcers. Passive smokers have a 30% chance of developing lung cancer. India has just one operation theatre per 1 lakh people. 7 million people suffer from preventable surgical injuries globally every year. 1 million die during or immediately after surgery. 1st December 2010, Times of India reported more than 25 million people around the world were killed by disease between 1980 and 2010. It has become the most critical epidemic in the recent recorded history of the world. Gujarat HIV 750 Varshan Kendra 44 Suraksha Kendra for estimate 19 ART centers and 29 linked ART for free AIDS treatment 16 DIC 20 district Jivan Deep Center. Times of India reported in 22 September 2010, India records 5.2 million injuries a year due to medical errors and adverse events. Biggest source of mishap from medications, HAI and blood clots that develop in legs from being immobile in hospital. Loss of 3 million years of healthy life in India each year due to these injuries. 130 million dependent people by 2000. Disability more common than death. Times of India, 27 September 2013. Report by an Indian doctor from Harvard School of Public Health concluded that 43 million people are injured worldwide each year due to unsafe medical care, resulting in nearly 23 million years of healthy life. Global burden of unsafe medical care across a range of adverse health events. 78.6% of all adverse events is in high income countries and 80.7% in low and middle income countries. Disability was more common than the death itself. 22nd September 2013, the Times of India reported that researchers also found that about two-thirds of the injuries and harm occur in low and middle income countries like India. For every 100 hospitalization, 14.2 adverse events in high-income countries and 12.7 in low and middle-income countries. Daily loss was more than twice as high in the low and middle-income countries, 15.5 million, as it was in high-income countries. Most common adverse events in the high-income countries were adverse events. Most common adverse events in low and middle-income countries were blood clots in the veins. Millions of people around the world are disabled and sometimes even die due to medical error. Data from India are poor estimation based on global average for low and middle-income group countries. Health policy and management. Patient safety program of the WHO and RTI International at Urban reports use data. They examine 7 different adverse outcomes that can occur while patients are hospitalized. Injuries due to medication, catheter-related urinary tract infection, catheter-related bloodstream infection, hospital-related pneumonia, blood clots in the vein, HSPH, health policy and management. WHO said over 7 million people a year across the globe suffer from preventable surgical injury. 1 million of them dying during or immediately after injury. The United Nations body quantified the number of surgeries taking place globally every year to 234 million. At any given time, 1 in every 25 people undergo surgery. China conducted the highest number of surgeries, followed by Russia and India. In developing countries, 10% death rate for major surgery. 1 out of 150 patients mortality from general anesthesia. 3% infections in surgery performed with mortality rate of 0.5%. Nearly 50% of adverse effects of surgery were preventable. 7 types of adverse impacts examined in the study ranked as 20th leading cause of morbidity and mortality for the world population. Not included in the study, use of infected needles, tainted blood products, and counterfeit drugs. When the patients were sick, we find that they are too often injured from the care that is being given them. Medical 5.2 million medical injuries are recorded each year. 43 million people get injured due to unsafe medical care worldwide. About two-thirds of medical injuries occur in low countries. 130 million dependent upon people by 250 at present with 64 million dependent people. 5.5% of Indian population requires others to take care of them. In another 35 years, India will be home to the world's highest number of people completely dependent on others to take care of them. Dependent people by 2000. This is the table form. How many people will be dependent is shown. In 2030, China having world population, Indian population, 1 to 2 million dependent, India 90 million will be dependent.